You ever come back from a CE and you learned a lot of things, but it's just you didn't really know what to do about it, or maybe it wasn't that impactful. In 2018, I had an experience that changed the entire course of my life. Not only did it change my life, it changed my husband's life, my daughter's life, many of my patients' lives, and it led me to never practice the same. You see, I pride myself on being up to date on all the latest CE. I'm actually pretty nerdy. It's my favorite thing to do is learn. So I was so surprised in 2018 when I learned that 1 year before, in 2017, the ADA had passed an amendment to say we need to be screening our adults and our children for signs and symptoms of sleep-disordered breathing. I never got that memo. It certainly wasn't anything that I learned in school. Did you guys learn anything about sleep apnea in school? I mean, I'm a pretty new graduate. I've been practicing for only a decade. I know many people went to school maybe far long ago than me, and it was probably not taught to you either. In fact, most doctors, pediatricians, nurse practitioners, most of the primary care physicians that we see have very little training in sleep apnea, if any. I got deep into a rabbit hole of learning things that I knew nothing about, because as I sat in that classroom, I all of a sudden had a realization, wow, I think my husband has obstructive sleep apnea. You know, I sat there and I thought, this is so obvious now. Once you know what you're looking for, why has nobody ever talked about this with him? You see, we had been on a journey with him for several years. He had been having some pretty severe memory problems. We didn't know what was going on with him, but he does have some dementia in his family, so clearly I was pretty concerned about it. Now, he took me as a nagging wife that said, hey, you know, he just thought he snored and there was no problems at all. However, I sat there in this class and I learned about snoring and all of the things anatomically that are going on. You know, we tend to think snoring is just a nuisance, something that is just annoying. We want to push our partner to the side, but this is not something that's just annoying. This is something that is life devastating. People die from sleep apnea every single day. Now, I often wonder, if I hadn't been sitting in that class, would I know anything about this? How many more years would it take before I got the memo about screening our patients for sleep-disordered breathing? You see, it wasn't just my daughter. I mean, it wasn't just my husband. My daughter was having a lot of problems as well. She was just 2.5 when she started having pretty severe night terrors. If anybody has ever seen a child have a night terror, you know how hard it is. There's really nothing you can do but watch them cry. And I just couldn't understand, why is this happening? So, you know, I go to good old Google and I'm trying to figure out what's going on with night terrors. And I start being just a little bit introduced into, this is a sleep disorder, but again, I didn't really know very much. However, once I went to that class in 2018, all of a sudden I knew all the light bulbs had gone off. My daughter had had a runny nose pretty much her entire life. So what did we do? We gave her allergy medicine. We treat the symptoms, right? She grew up with a snotty nose, and you know, you just feel helpless for your child. There's really nothing you can do. So I continued for years and years to give her allergy medicine. Now, let me tell you, when I got back from this first class, I got off the plane and I told my husband, you are totally getting a sleep study. I know this has something to do with your memory. And of course, no, this is nothing. And I'm telling him, no, look, you've got a problem. Our daughter has a problem. I think I've got a problem. And nobody's doing anything about this. I was so gung-ho. I wanted to learn everything. I mean, I went to course after course after course, because when I was looking for providers to help my family, there were no providers in my area. If I wanted my daughter, my husband, my niece, anybody in my life that I saw these problems with, if I wanted them to have treatment or find the right providers, I was going to have to do that. So that's what I did. I went on a mission. You know, I talked to my pediatrician and I said, hey, she's got this runny nose. She's just inflamed all the time. And he said, well, let's just switch her allergy medicine. I said, see, the thing about it is, are we going to do this for the rest of her life? I mean, what is she allergic to? So he said, you know, this is very common. You know, I see this all the time. And I said, I understand that, but I'm just not okay with giving my child medicine every single day and never asking why. Why does she have these allergies? Well, turns out my pediatrician at that time, he just wasn't interested in going the route that I was interested. Unfortunately, pediatricians have a lot of patients in a day. They have a lot of things to do. And having a long conversation with a mom that is concerned about my child is probably not the best way he's going to spend his time. He said, I'll be right back. The nurse will come right in. So I try to plead my case again. As you know, in the dental industry, you know, the dentist leaves and then the assistant comes and they kind of say it in layman's terms to you. So I'm trying to get the nurse to understand, look, I really, really need a referral for an allergist. And she said, again, you know, he really is pretty conservative. If this continues, you know, maybe we'll try allergy testing later. So I had to find a new pediatrician, and this poor lady, when I found her, she probably thought I was so much, but I come to her and I say, my child's had a runny nose her whole life. What can we do about this? We got allergy testing, found out she's allergic to milk, eggs, peanuts, pretty much everything we'd given her her whole life. So all of a sudden my eyes were open. I knew that, okay, what else is going on? Her tonsils, she had these huge tonsils, and the pediatrician, the former pediatrician, would say, she'll grow into them. Well, what I didn't know is these tonsils are blocking her airway. She had a 3+ tonsil, and what that means is that they're almost touching. She was 3 years old. She's 3, she's snoring, she's got all these allergies, and if I didn't know anything about anything, I would have just continued to give her allergy medicine. So what I learned is that we as hygienists, dental professionals, dentist assistants, all of us, we see the patient. We know our patients. We see that they're tired. We see their physical signs and symptoms. So if we see a patient and we're looking in their mouth and they have these huge tonsils and they're gagging, we're the people that can have that first conversation. So we're going to talk about just 3 simple things to look for. It's the boa. So you can think about like a boa constrictor snake that constricts your neck, because that's basically what's happening when you have sleep apnea. So the B is for bruxism. How many of you guys, oh, you grind your teeth? You need a night guard. That's what I always did. My husband had been grinding his teeth for so long, I can't even tell you how many night guards he's gone through. But bruxism is one of the signs that we're looking for with airway disorders. So anytime you see bruxism, you know we need to investigate this more. Orthodontic needs. If you see a patient, 3, 5, 7, however old they are, if you think this child's definitely going to need some braces in their life, well, it's probably that they've got more going on than just needing some braces. Why are these teeth crooked? What happened here? What is going on with the growth of this child that they don't have enough room? So if you see orthodontic issues, malocclusions, cross bites, anything that looks out of the norm, it doesn't matter if they're 3. We see the problem now. Let's not wait to fix the problem later. The last thing is airway, okay? When we look at mouths, for so long I looked at teeth. I looked at teeth, I cleaned teeth, and I never once really looked at an airway. I wasn't trained to look at the tonsils. You know, I was trained just, you know, clean teeth, you gotta clean teeth. And of course, I'm very oral systemic in nature, but I just simply did not know that that was something to screen for. Once you know, you know. I hope all of you guys are getting a mental picture of a child in your chair with these ginormous tonsils, gagging all over the place, bags under their eyes, and you might be the first person to say to that mother, you know, have you asked your doctor about, you know, what's going on with the allergies? Does your child snore? I get teased because I stopped asking about brushing and flossing, and all I talk about now is, do you snore and do you breathe with your mouth open? So again, BOA, think about your neck being constricted. Look for bruxism. Look for orthodontic needs. Look for airway conditions. So if you see big tonsils, encourage that mom, encourage that parent to get the necessary help for their children, because who's going to advocate? You are. So please advocate for yourself, your family, and your child. Thanks so much.